Hey everybody, Grandma Shark MD here with an update on COVID-19. First of all, I'd like to say a big thanks for social distancing, or what's actually physical distancing. I think you really should be social and call up your family, call your friends, spend some time on the phone. There's a lot of people out there that need to talk and they're isolated. This is the fourth time I've created an update on COVID-19, and over time, my recommendations have really changed a lot. I think this is what's confusing a lot of people, not just my recommendations, but their healthcare systems recommendations are constantly changing. For instance, today there was an announcement that it would probably be a good idea to wear a mask, even a homemade one, when you go out. Working in the emergency department, we've also been getting updated recommendations from our hospital's administration and leaders. And I'd like to share some of those so you can understand a little bit more about what's going on. First, I'd like to recommend a couple of websites that I'm following and that are available to the public. The first one is the Johns Hopkins COVID map. And here it is, okay? That is coronavirusjhu.edu/map. And it has confirmed cases in the world and deaths country by country. What I'd like to point out on these graphs is you can see the rate of increase of cases and also when the curve gets flattened out. For instance, right now, our rate of increase on this curve, and it's in the bottom right corner, and you probably should follow with me, is exponential. And this is only confirmed cases. In cities like New York, they're so overwhelmed, they're not even testing patients. They're just looking at the clinical picture and determining if the patient is well enough to quarantine at home. So when you see, as I speak right now, the total cases in the US is 140,000 or more. It's probably 2 or 3 times that, because the truth is we don't have enough tests and we don't have the rapid tests available. This is the algorithm that I have to use in my hospital to determine whether or not I should test, because we don't have enough tests. So first of all, you have to have signs and symptoms of an acute respiratory illness, cough, feeling short of breath, or fever. Now, we know that we're hearing that a lot of patients are asymptomatic, or they're having symptoms such as muscle aches being the predominant symptom, along with some diarrhea. And I've seen patients that look very much like that. And if they're in the healthcare industry, I'm going to test them because I think that they might have it. So those are some of the patients we're supposed to test. We're supposed to test patients that are in nursing homes or shelters, correctional facilities. We're supposed to test, of course, healthcare workers such as emergency medical services providers, fire, police, and other patients who are receiving treatments such as dialysis or chemotherapy. So we also have the discretionary option of testing a patient if we think the patient is worsening in their respiratory symptoms, if the patient is under 1 or over 65, or has other medical diseases like lung disease or diabetes or immunosuppression or heart disease, or if a patient who is pregnant. So you can see that we are not testing very many patients, and we are sending them home to quarantine at home. Also, the family members of patients who test positive for COVID-19 are assumed to have it themselves and are told to quarantine at home. As the numbers get larger, those people who have quarantined at home are going to need help from friends and family to go to grocery stores or bring them food and help them to stay separate. And so this is one way that you can volunteer in your community. There's one more thing I'd like to point out on the Johns Hopkins website, and that's the curve for other countries, such as Korea, South Korea, that is. As you can see on their curve, it is flattening out. They did a lot of testing, and they're able to enforce lockdown. So their curve, their curve went up and then it's flattening. So I really think that more testing will really help us to improve the specificity of our quarantine and maybe get us back. The second website I'd like to talk about is healthdata.org. And this is one that you can look at, healthdata.org. It's supported by the Bill and Melinda Gates Foundation, and it shows you the COVID statistics for the United States in general, what they're predicting, how many cases we'll need, and it also helps us to determine how many ICU beds we're going to need, how many ventilators we're going to need, and what our shortages are. It goes also by state, so you can see that some states like Texas or Arizona are in great shape. States like New York, who closed down later, and who are very highly condensed, are in bad shape. And there you can see what they're predicting, that they're going to be short. Their bed shortage will be 35,000 beds short. Their ICU beds will be short by almost 7,000. So I'm telling you this because I think that knowledge and gives you a sense of control. It also shows you where there's an end in sight, and that you can, see that what we as healthcare providers are looking at and trying to do to help deal with this pandemic. There's also things you can do to help your own mental health. And I think the number one thing you should do is, when you get up in the morning, get out of bed, get dressed, make your bed, write a to-do list, exercise. I know a lot of you are missing the gym. Exercise at home. There's plenty of apps out there. There's one I use called Road Warrior. You can do your exercises right in a hotel room, and it really will kick your butt, especially the crunches. You also can consider, if you're a parent working from home and you've discovered that it is impossible to work with your kids underfoot, you might want to consider hiring an out-of-work waitress, bartender, or chef to be a temporary nanny. Who knows? You out-of-work actresses and actors, you could possibly be the next Mr. Rogers. And it's not like you're going to have to do a full background check on somebody that you hire. You're going to be in the house with that person. So think about that. There are other things that you can do. I think, you should meditate. That is also a good thing to do. But remember, what you're doing now by staying home and social, or actually physical distancing is really the number one thing that is going to save lives. That's going to be it. So take care and check out those websites, and please subscribe and send me messages. I will answer emails on grandmasharkmd@gmail.com. Hey, peace.